I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. We often take our feet for granted until they start to hurt. How can we keep our feet healthy so they can support us? This is the People's Pharmacy with Terry and Joe Graydon.
Sandals, flip-flops, and other warm weather footgear don't always offer the support you need. Find out how to select shoes and sandals that do.
If your toes are on view, you might be embarrassed about thick yellow nails. What should you consider about treating toenail fungus? What's the best approach?
If you have questions about bunions, hammer toes, plantar fasciitis, or other foot problems, today's guest has answers.
Coming up, the People's Pharmacy podiatrist answers your questions on foot health.
In the People's Pharmacy Health Headlines, the FDA has approved the Alzheimer's drug donanemab. Approval had been delayed because of questions regarding the protocol used in the clinical trial. Eli Lilly will sell the drug under the brand name Kisunla. This infused medication reduces amyloid plaque in the brain. Before starting on Kisunla, patients will need PET scans to verify that they have amyloid plaque buildup in their brains. Unfortunately, this monoclonal antibody does not reverse cognitive decline. People taking Kisunla in the clinical trial got worse more slowly than those on placebo. On the standardized 144-point integrated Alzheimer's disease rating scale, people on placebo dropped almost 3 points more than those on donanemab. There are some safety concerns regarding this medicine. The FDA warns physicians about amyloid-relating imaging abnormalities. These may indicate brain swelling or bleeding, which can be serious. The most common side effect is headache. The annual cost is projected at $32,000 a year, not including the cost of PET scans.
Since the turn of the 21st century, older people have started taking more medications. Researchers analyzed data from the National Health and Nutrition Examination Survey between 1999 and 2020. At the start of the study, 84% of people over 65 were taking prescription medications in the last month. By the close of the study, that number had risen to 90%. The mean number of medications also increased. In 1999, 24% of the volunteers in the study were taking multiple medications known as polypharmacy. By 2020, 43% were included in the polypharmacy category.
Many people who have taken an antidepressant and then stopped taking it report uncomfortable symptoms. A study published in Lancet Psychiatry reviewed 79 studies of people discontinuing their antidepressants. 44 of these were randomized controlled trials, allowing for comparison between placebo and antidepressant. Approximately 1 person in 7 had discontinuation symptoms that could not be attributed to the placebo effect. The medicines most frequently associated with discontinuation problems such as dizziness, headache, insomnia, nausea, and irritability included desvenlafaxine, venlafaxine, imipramine, and escitalopram. The most severe symptoms were linked to imipramine, paroxetine, desvenlafaxine, and venlafaxine.
Substance use disorder remains one of society's great plagues. It's estimated that nearly 3 million people have opioid use disorder, while more than 28 million Americans misuse alcohol. Medications to help people overcome their dependence on opioids or alcohol are underutilized. In particular, naltrexone has been found to be safe and effective for both disorders. The authors of a new study report that medications such as naltrexone, buprenorphine, or acamprosate are underutilized, especially in rural communities.
Intermittent fasting has been hailed as a potential therapy for type 2 diabetes, but it's not widely prescribed. A new study shows how effective this approach can be. The scientists recruited about 400 individuals recently diagnosed with type 2 diabetes. They allocated these participants randomly into one of three groups. The primary outcome was HbA1c, a measure of blood glucose over time. One group took the diabetes drug metformin. A second group took Jardiance. The third group fasted for 2 non-consecutive days each week, reducing their intake to just 1/4 of their usual calories. People in the intermittent fasting group reduced their HbA1c the most. 80% of them got their HbA1c down below 6.5%, whereas 60% of those on metformin and 55% of those on Jardiance did that well. The researchers suggest that intermittent fasting could be an effective lifestyle intervention. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon. I'm a medical anthropologist.
And I'm Joe Graydon. I'm a pharmacologist. Today, we are considering the steps you can take for healthy feet. Do you have questions about a foot problem, such as plantar fasciitis or bunions? What about ingrown toenails? We invite you to join the conversation. Our lines are open, 888-472-3366. You can email us your questions and share your story at radio@peoplespharmacy.com. That number again?
888-472-3366. And today we are delighted that the People's Pharmacy podiatrist, Dr. Jane Anderson, is joining us to answer your questions. She's in practice at Chapel Hill Foot and Ankle, part of FASMA, Foot and Ankle Specialists of the Mid-Atlantic. Dr. Anderson specializes in foot and ankle care for children, adults, athletes, and geriatric patients. She is a trustee of the American Podiatric Medical Association. Welcome back to the People's Pharmacy, Dr. Anderson.
Thank you so much for having me back. It is great to be here.
And we welcome your calls. Again, that number, if you've got a foot issue that you would like resolved, we have the answers. 888-472-3366. Dr. Anderson, it is summer, and that means foot gear. It means sandals. It means flip-flops. Is there anyone who should avoid wearing flip-flops when they're, walking around outside or at the beach? We've heard all kinds of things about flip-flops, and are there any that are better than others?
Absolutely. So flip-flops have actually really evolved over the last 20 years. 20 years ago, I would have said, nope, no one should be wearing them. They're terrible. Really, the only place you wear those flimsy flip-flops is in the shower at the gym. But now we actually have flip-flops that have arch support, and we have flip-flops that have a lot of cushioning and protection and things like that. So we're in a situation now where people can actually wear flip-flops if they're appropriate for their condition.
Are there some brands that are better than others?
There are. So my first thing that I always like to talk about is that the APMA, which is the American Podiatric Medical Association, has a SEAL program, meaning they have an independent panel of podiatrists who have tested these shoes. And so if you go on the APMA website and look at the SEAL program, you can find a list of shoes, including flip-flops, that are actually shown to be good for your feet. Some of the brands that I recommend are Vionic, Atrex, Chaco makes some great sandals, and there are several others, but those are some ones that pop to mind. OOFOS is a great brand of recovery sandals that we actually have in our office.
How do you spell that?
OOFOS.
UFO.
Okay.
OOFOS.
Okay.
They're very comfortable.
And you said that you should choose these flip-flops according to your foot condition. Will you be able to tell that from the APMA website?
Maybe not your foot condition, but there are a lot of things to consider. So if you have plantar fasciitis, which is heel pain on the bottom of the foot, you really need a lot of arch support and maybe a little bit of cushioning. If you have diabetes, you might want to rethink actually wearing the flip-flops because you don't want little rocks getting in underneath, especially if you have numbness in your feet or neuropathy. You may not be able to feel if something gets caught underneath there. So a closed shoe is better for that patient.
Okay, let's go to the phones. We're going to Lakeview, South Carolina. Bonnie, welcome to the People's Pharmacy. Tell us about your question.
Hi. My question is about toenail fungus. My husband's been suffering with it for a while, and we've been wondering, is there actually a cure for it?
That is a loaded question. There are actually a lot of treatments for toenail fungus. It is very hard to treat. It is something that once it gets in the toenail, there is no guarantee that where you're going to get rid of it. There are some treatments that can be very effective, and it really depends on how much toenail fungus there is in each toenail. It depends on the age of the patient and whether or not they're immunocompromised. That makes a difference. There are treatments such as laser, oral medications, and topical medications. Something that has changed recently with toenail fungus is that some of the testing has improved. There are now PCR tests, which actually gives us sort of DNA identification of the type of fungus. So sometimes if that test is done, you can target the treatment a little bit better.
And my understanding is that testing sometimes reveals something surprising, like it's not fungus.
Right.
Or it's fungus and bacterial.
Exactly. So sometimes we discover that there's actually a bacterial infection. That's true. So there are a lot of factors in that. That PCR testing is not always covered by insurance also, so it gets a little expensive for some people. There are some basic treatments that we try. For me, oftentimes I will take a sample of the nail and send it to the lab just to confirm that there's fungus before I actually treat someone orally. Topical treatment is a little bit safer but less effective, so we have those things. But it is a difficult problem to control, Bonnie.
What else might it be besides toenail fungus?
Oftentimes, people will have a thickened nail from trauma, and that can be like I dropped something 20 years ago on my toenail, or it can actually be repetitive microtrauma. So if your toenail touches the inside of your shoe, then you are not only setting that toenail up for a fungal infection, but just the pressure and trauma from a shoe can make it thick on its own.
Now, of course, we do drive dermatologists and podiatrists crazy when we talk about home remedies because some people tell us, well, half old-fashioned amber Listerine together with vinegar, white vinegar, 50-50. If I do it every day for weeks, months, sometimes years, it will go away. Others have been telling us about neomycin, the topical antibiotic. They say, I've been trying to get rid of this fungus for years. Nothing ever worked. But then I tried this antibacterial cream, neomycin, this ointment, and it went away.
So for some people who presumably have bacterial instead of fungal infections, it seems to work.
That could be the case. The interesting thing about neomycin you really have to watch is that is one of the higher allergic reaction provoking drugs, right? So the topical Neosporin, I caution people against using that unless they know they can tolerate it.
Right.
Yeah.
Back to the phones, Terry.
Let's talk to Elizabeth in Oak Hill, West Virginia. Elizabeth, welcome to the People's Pharmacy.
Hello. Thank you very much. You might be talking right to me about this fungus. I don't know. My toenail, not the big toe, but the other toes curl up in a kind of a half moon, but a little bit more than that because both ends kind of go into the skin, and there is a white substance in there, seems like.
So when you say the toes curl, or are you talking about the toenails, Elizabeth?
I'm talking about the toenails, I'm sorry. The toenails go almost like a half moon, and there's a white substance in there that keeps me from having, they're hard to cut, and they don't hurt, but they look strange, and I can't I soaked my feet yesterday trying to see if I could get that white, whatever is in there out, but I can't.
Sometimes the fungus that like will make a toenail thickened and yellow. There are different types of fungus, and some of them will actually make a white chalky material on the top of your toenails. And it's just a different type of onychomycosis, we call it. And that often responds to topical medications and filing it. But if the nail is deformed, you should probably see your podiatrist, because there are things that will make them deformed, like a spur underneath your toenail, or possibly trauma or ingrown toenails. So you may need to get that evaluated at some point. But the white superficial fungus is a little easier.
It is travel season, Dr. Anderson. People are getting ready to go all over the world, and they want to know what shoes they should be wearing.
Yes, travel season is in full swing, and it is so important to wear the right shoes when you travel. And what I usually tell my patients, and I have a big traveling population in my practice, is that you should, wear your most comfortable shoes, usually an athletic shoe or something that you're good with. When you go to Europe these days, everyone wears trainers there. Do not feel like you're going to...
What's a trainer?
A trainer is an athletic shoe. That's what they call it. But it used to be sort of taboo for Americans to wear athletic shoes when you're traveling in Europe. But now everyone does it there as well. So wear your good athletic shoes, replace them about a month before you go so that you're traveling with a current shoe that is not worn out or broken down. And just make sure you've got good, comfortable socks that you don't get blisters with. And you might practice walking a little bit more than your norm, just because that's what happens when you're traveling.
Blisters, any way to avoid them?
So I think the best strategy is to make sure your shoes fit well, but also to choose socks that wick moisture away. So not 100% cotton. 100% cotton actually, it breathes, but it holds the moisture in the fiber. So if you look at socks, which you can even find at discount stores that say wicking socks, dry fit, dry weave, dry tech, things like that. Those are some key words. Those socks will be more likely to protect your feet in that sense.
And besides cotton, what other fabrics?
So usually they're acrylic blends. There might be a little bit of cotton in there as well. Wool is a great fiber for this as well. So Smart Wool is a brand of socks that is wonderful year-round.
We are talking with Dr. Jane Anderson. She is a podiatrist, in fact, the People's Pharmacy podiatrist, and we welcome your calls, your questions. We're talking about feet today. 888-472-3366. You can email us. That address is radio
at peoplespharmacy.com. And Joe, we are really coming up on a break.
We are coming up on a break, but we'd love to hear your questions. What about hammer toes? What are they? Ingrown toenails? What's the connection between athlete's foot and toenail fungus?
Is there a connection?
We'll find out. Again, if you'd like to join the conversation, our lines are open. 888-472-3366. We're going to go to Jose in Dallas when we come back, but we'd love your questions as well. Radio at peoplespharmacy.com.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is made possible in part by CocoVia, backed by 20 years of scientific research and the maker of the most proven and concentrated flavanol extract in the market today, CocoPro Cocoa Extract. Cocoa flavanols are among the most studied plant-based bioactives today and are clinically proven to promote cardiovascular and brain health for the long term, supporting a strong heart and better memory.
Get 15% off your order of any CocoVia product by using the discount code PPOD15. Learn more at CocoVia, and remember that discount code is PPOD15.
These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible in part by CocoVia Dietary Supplements. This summer, keep up with your heart and brain health with cocoflavanols for a strong heart and cognitive support. Consider how CocoVia might be a part of your supplement routine. More information available at cocovia.com.
Today we're talking about key steps for healthy feet. Our guest here in the studio is Dr. Jane Anderson, a board-certified podiatrist in practice at Chapel Hill Foot and Ankle.
And we'd love to hear your story or your question. Our lines are open at 888-472-3366. When the lines are full, as they are right now, you can email us. The email address is radio@peoplespharmacy.com. Let's go
to Roanoke, Virginia.
But wait, there's
Wait.
Jose in Dallas, Texas, and we lost Jose, but his question was Achilles tendon burning sensation. What could be going on?
So it sounds like probably there's some Achilles tendonitis going on with that. And that's something that I encourage Jose to actually get treatment for sooner than later, because the longer you have it, the harder it is to get rid of. The Achilles tendon is sort of temperamental, and I think it's good if you can see someone quickly. So they can look up on apma.org to find a local podiatrist.
Okay. That's the advice for Jose. Let's talk to Mina in Roanoke, Virginia. Go ahead, please, Mina.
Hi, this is Mina in Roanoke, Virginia. I'd like to know what is the difference between Lapiplasty versus the standard bunion procedure?
Well, before we even start on the procedures, Dr. Anderson, please tell us, what is a bunion?
So bunion is a deformity that happens in the foot where a bone moves out of place and you get a big lump on the side of your foot near the base of your big toe.
Now, what causes it?
So usually it's a genetics. It's aggravated by shoes. It can be aggravated by shoes, but certainly there are people that never wear tight shoes that have bunions. So if your grandmother and mother had bunions, your chances are probably a little bit higher that you would have a bunion as well. There are a lot of factors when we consider what bunion procedure to do. So conservatively, we have people wear pads and wide shoes and sometimes orthotics, which help control the motion that leads to the bunion deformity. But the procedure itself, there's a lot of factors that we take into account. What is the age of the patient? What is their bone quality? What does their x-ray look like? What are their angles when we measure them? And what are their expectations for, correction and things like that? Lapidus, so Lapiplasty is a brand name of actual hardware that fixates those. So whenever we cut bones and move bones, we actually have to put screws and plates and things like that in to hold those bones in place. So Lapiplasty is a brand of hardware that helps people perform what's called a Lapidus. So the Lapidus we've been doing for decades. The Lapiplasty hardware came out more recently. So there are some surgeons that do the Lapiplasty, which is a great brand of hardware, and there are other surgeons that do other brands of hardware. And you should end up in the same place when it's all done, regardless. So I know Lapiplasty is very popular because they direct market to patients, so people are more aware of them. But if your surgeon doesn't do the Lapiplasty, then it's okay because they may still do the Lapidus if it's an appropriate procedure for you.
We have a bunch of emails. Let's see.
We sure do. We've got Paul, who wants to know, what do I do to shrink the bunion? Well, we're talking about bunions, without letting the shoe touch my toenails. Is there any way to do that?
So you can't really shrink a bunion once you have that bony deformity. It's there. What I often recommend, very old school sort of, is to get yourself a wooden shoe stretcher, which is something you can find on Amazon, and you can actually stretch your shoe out in that area just to remove any pressure on your bunion. If the shoe is touching your toenail, it's likely that the shoe might be a little too small.
I have an email from Aaron in Texas. How can I soften my toenails? I'm 57 and my toenails are getting harder and scratchier by the day. Is there anything I can put on them to soften them?
Well, that would be a thing of why are your toenails hard is the question, right? So is it because of a fungal infection? So perhaps going to the podiatrist and having it tested to see if it is a fungal infection. Some people use like the Vicks Vapor Rub to soften their toenails, and that will soften it a little bit. So
Now, I've got another question. Terry, I'm looking for the Lynchburg question. There it is. Brenda in Lynchburg says, I switched to Hoka Clifton's a few years ago. I used the Cadence Orthotics. I keep getting hard calluses on the outside of both feet, at the bones in the middle of the feet, also the bones on the outside right below the little toes. I pronate and my arches flatten without orthotics. Is there a fix? And first, you're going to have to tell us, what are Hoka Cliftons?
Okay, so Hoka is a brand of athletic shoes that's a great brand. They are pretty notable. You've probably seen them because they have a very thick sole. So they're very highly cushioned. And when choosing shoes, when I make recommendations to a patient about athletic shoes, I'm watching them walk. I'm looking at the shape of their shoes. I know where their calluses are and what they should be doing. So there's a lot of factors that go into those choices, especially with an over-the-counter or custom orthotic. So that's something to take note of, is that, well, if you have an over-the-counter orthotic in there, would you be better off with a custom one that can accommodate for those areas that you develop calluses?
Let's go to Rapid City, South Dakota, and talk to Roger. Roger, what's your question?
Good morning. How are you guys? We just had a little rainstorm here in Rapid City, along with 100-degree temperatures. I'm 77 years old, and in good health, and very grateful. The top of my left foot and the outside of my left foot will hurt. From what I've been told by really good physicians, they say that when you get into the area of your foot with the nerves and the veins, to be very cautious of any possible procedures. I do use Voltaren cream and a formulated RX cream, which helps. The pain is not such that that it's overwhelming. It's just more, a little more than an annoyance at times, and some days a little more than that, depending on the type of exercise. Just wondered, any thoughts or ideas?
It's really hard to tell you, Roger, exactly what's going on with your foot without seeing you and taking an x-ray. It sounds a lot like my patients who have arthritis through the middle part of their foot, and they tend to respond to using the Voltaren, and topical and things like that is great, but not walking barefoot and wearing a firm arch support. Because if you support those joints through the middle part of your foot, sometimes that helps control arthritic pain.
I've got an email from Greg in Augusta, Georgia. I'm a lifelong athlete and do triathlons and race mountain bikes. My question involves occasional foot cramps, usually if my feet are a little cold. Any recommendations to avoid those cramps?
Well, I have a protocol for cramps now. I kind of developed it over the years. My first protocol for people, and sometimes it's just an older person at home who gets leg cramps at nighttime. My first protocol is, are you drinking enough water? And if they are drinking enough water, my second protocol is, are you replacing your electrolytes? So I often recommend like Liquid IV is a great electrolyte replacement, or even Gatorade, or even something called S-caps, which are like salt capsules. And then my last thing that I usually go to is magnesium, because I find that to be helpful for some people.
We have received many messages, especially from long-distance bike riders. Mustard, yellow mustard. And what they do is they say, we go into the fast food store, we stock up on those little packets, we take them with us on the bike ride, and when we start to cramp up, we start sucking down those little packets of yellow mustard.
Right. I think we talked about that before. And
We
I
have
think
almost certainly talked about it before.
And I think it's great for the immediate
Yeah.
onset of cramp is what we talked about in the past. But I do feel like in order to sort of prevent this from happening, that's kind of, the strategy that I'm trying to use as well. Because in the middle of the night when people get leg cramps, laying in their beds, they're unlikely to want to consume mustard.
I have done it.
I'm sure you
have
have.
done it. Now, in terms of prevention, for example, we actually have an email from Michael who says he gets tendinitis in his toes. Are there exercises to do to reduce tendinitis in the metatarsals?
So metatarsals are different than toes.
Yeah,
So
that's what I thought.
metatarsals are the bones in the front of your foot at the base of your toes. And it's interesting. I'm not sure which tendons, because there's a lot of tendons that are involved in that part of the foot. But what I do for toe exercises is helpful for a lot of things, including hammer toes.
What's a hammer toe?
So a hammer toe is when your toe sort of buckles up. And you get a bend in the toe. And there are people that have rigid hammer toes, meaning they cannot straighten them. And there are people who have flexible hammer toes. And the development of hammer toes can actually put a lot of pressure on the ball of your foot, because the toes curl up and push down on the bones below them. And you get this sort of pain on the ball of your foot. And those are your metatarsal heads. So they're all connected. But one of the exercises that I like to use for that is I like to strengthen your intrinsic muscles. So there are two sets of muscles that control your toes. There are your extrinsic muscles, which are large muscles in your leg. And those are very strong compared to the little tiny muscles in the bottom of your foot. So what you may not know is that there are 4 layers of muscles in your arch. There are that many muscles. And those weaken faster than the ones in your legs. So I put people on an exercise program where I say, go get some toe spacers. Yoga Toes was a popular brand. I think they're too big and too bulky. So I use a brand called Mind Body that you can get on, it's BODHI, that you can get on Amazon. And I have people put these spacers in. So it looks like you're getting a pedicure, but maybe a little bit more so. And I have people put them between their toes and squeeze from side to side, not curl their toes up and down, but squeeze from side to side, because that actually activates the muscles in the arch. Those are the actions that those muscles do. And that will help sort of stabilize the toes a little bit over time.
Let's go back to the phones. We've got a call from Tim in Richmond, Virginia. Tim, let us know what's troubling you.
Hello. I wore slippers every day for months, and then when I switched back to my regular sneakers, I started to have a burning pain on the bottom of my foot that was accompanied by like sharp pains and like really hard skin. What could that be?
That's a really interesting question. I'm rarely stumped by these questions. I'm not quite sure exactly what that would be. It may be a change in the level of support of what you've been used to. Most people do better with shoes than with slippers. So that's where you're a little bit outside the norm in that. I would say maybe take a look at the shoes and make sure they're fitting you appropriately and that they offer you the right amount of support to start with. And then I would probably say go see your local podiatrist to see.
I'm kind of curious.
Yeah.
I mean, here's Tim wearing slippers every day for months. Now, I have really flat feet, and I'm just wondering, slippers, generally speaking, don't have any support. Could that have had a contributing effect?
Usually it does, and it's even possible for, if your feet are weak, to sort of, your foot flattens out even more when you're walking around barefoot or wearing slippers, and that could create problems with tendons and things like that.
So, Tim, why were you wearing slippers every day for months?
I was just wearing slippers. I was in the house. I didn't have to leave out, so I would just put slippers on.
Okay. Well, I take it you've given up on the slippers. Is that right?
Yes, sir.
Okay. Well, I'm sorry we can't come up with a perfect answer, but maybe it is time for you to see a podiatrist, because sometimes you can't answer all the questions over the phones. Our lines are open for your questions, your stories, 888-472-3366. If our lines are busy, and they have been, you can email us, radio at peoplespharmacy.com. Where to next, Terry?
We're talking to Caleb in Fort Worth, Texas.
Hi, Caleb. What's on your mind?
Hello. Sorry about that. Yeah, I was calling. I had a question. I have, for a while now, a long while, on the bottom of my feet, the skin peeling and cracking, both feet. And then one of my feet, the two smaller toenails, has, I guess, the fungus. They're yellow and hard and thick. So wondering if these are associated to each other and what would be the recommendation for that.
So what about this peeling? What's that about?
So it turns out we alluded to this earlier, is that most likely that's a fungal infection of the skin, which we call either athlete's foot or tinea pedis. And it is generally the same organism that will cause that skin infection and cause the toenail infection as well. It is very, very hard to control the toenails, but is much easier and much more important to control the skin infection. The cracks in the skin can lead to a secondary bacterial infection, so it is important that you treat that. So some strategies for that. You can start with something over the counter. There's Lamisil or Lotrimin. When you treat an athlete's foot infection, treat an inch beyond where you see that scaling. So it's like you're wearing a moccasin, the whole bottom of your foot, between your toes, on top of your toes, and up an inch beyond. Make sure you bleach out your shower consistently. Make sure that you're changing your socks and that you wear socks that wick moisture away that we talked about before. And just treat consistently till it goes away. The over-the-counter stuff may take 6 to 8 weeks to treat that, but it's important that you get it under control.
Well, we are, you are looking at me like the Cheshire Cat, Joe.
No, I was just wondering, we have 1 minute before our break.
Yeah, we do. We have 1 minute before our break. And you know what? We have an email from Michael who says, for years I had foot problems. Sometimes the pain was so bad I couldn't walk. One podiatrist prescribed a nighttime boot device, and that didn't help. The next one made a custom orthotic that did help, but walking was still worse than when going barefoot or wearing Birkenstocks. So what's different about wearing his shoes? He said, my official shoe size, as measured in the expensive shoe store, was 9B. Changing to a 10.5 double E, all my problems went away. So what's the story there? He says your feet need room.
Yes, they do. And I find that athletic shoes run about a whole size small. So I wear a size bigger in athletic shoes than I do in regular shoes. So that certainly can be part of the equation. There are a lot of things that we prescribe those devices for. It could have been plantar fasciitis, which is heel pain, but it is one of those things. I'm glad he feels better. The right shoe makes all the difference.
Well, we do need to take a short break, and in a bit we'll talk about sprained ankles, as well as blisters and other problems.
And our lines are open for your questions. We're running out of time, so call now, 888-472-3366. Email us, radio@peoplespharmacy.com.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is brought to you in part by the People's Pharmacy and our exclusive line of magnesium-rich roll-on deodorants, crafted with years of expertise and community feedback. Our customers rave about their ability to control odor effectively without aluminum. These deodorants are a superior choice for daily health and comfort.
Each is designed to be gentle yet highly effective, providing reliable odor control without aluminum or other harsh chemicals. Plus, they're incredibly easy to use and long-lasting.
As a special offer for our podcast listeners, enjoy an exclusive 20% discount on any size of our deodorant. Choose between the handy 2-ounce scented or unscented varieties, or the economical 3.38-ounce unscented version.
Simply visit the body care section in the store at peoplespharmacy.com and enter the promo code POD20, that's POD 20, during checkout to redeem your discount. Remember, this promo code POD20 gives you 20% off your purchase of our top-rated magnesium-rich, aluminum-free roll-on deodorants until August 2024.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible in part by CocoVia dietary supplements. This summer, keep up with your heart and brain health with cocoa flavanols for a strong heart and cognitive support. Consider how CocoVia can be a part of your supplement routine. More information available at cocovia.com.
Today we are talking about foot health, and we have an expert right here in the studio to answer your questions. Dr. Jane Anderson practices at Chapel Hill Foot and Ankle. She is a trustee of the American Podiatric Medical Association.
What foot problems are troubling you? You can give us a call at 888-472-3366. You can also email us radio@peoplespharmacy.com.
And we have an email from Pete. He says, after 14 years of iodine, over-the-counter treatments, ultraviolet light, laser, and many more, Neosporin is killing this growth. I clean and apply daily. Finally, the improvement is making a huge difference in my toenails. It's unbelievable. So somebody got, what we discover is some people will say, oh, yeah, that amber Listerine and vinegar worked like a charm. And then other people say, it didn't work at all. I used it for months. It was a total waste of time.
Yes. Home remedies are probably less reliable than actual medications, but even medications don't work all the time, especially not for nail fungus.
Right. And there are some organisms that are showing resistance to some of those medications, and that's where some of that testing can be very helpful. But regardless of what you choose, it's going to take a year to treat toenail fungus, no matter what you choose. It just,
toenails grow slowly.
Right. And the big toenail takes about 9 months to grow out, so it really is going to take a long time.
Back to the phones, Terry.
Okay, let's talk to Dan in Rocky Mount. Hey, Dan, what's on your mind?
Is this for Dan Donaldson?
Yes, sir.
Go ahead.
Yes, ma'am. Thanks for having my call. I've been suffering with neuropathy for about 3 years. I've gone to a podiatrist several times, and they gave me creams and stuff, but nothing really worked. And I went online and saw something that is like a tensing unit for feet. And I've been doing that for a few months, but it really hasn't done that good. So I'm kind of in a dilemma here about what to do.
So first of all, Dr. Anderson, what is neuropathy, especially in the feet, and can anything be done about it?
So neuropathy can be neurologic symptoms in the feet, burning, tingling, numbness. Sometimes it's very painful, sometimes it's not. If there's profound numbness, then a patient's in danger of hurting themselves without knowing it. So typically these patients either have diabetes or there are a lot of causes. Alcohol can be a cause, vitamin deficiencies, but a lot of people just have idiopathic neuropathy, meaning we don't know why they have it. There are no cures for neuropathy. There are a lot of things that can actually improve your symptoms, but they don't always work. So one of the supplements that I recommend is alpha lipoic acid, or ALA, and you start at 600 milligrams a day. There are also compounded drugs that will combine that with, some B vitamins and things like that sometimes I prescribe. There are now, for diabetic neuropathy, there is an indication for spinal cord stimulators that, can actually diminish the pain significantly. So hopefully that could be an option if that's the
Terry,
case.
did we hear from a physician once who said something about benfotiamine?
Yes, he did. Yes, that was Dr. Charles, and he recommended
It's a B vitamin.
benfotiamine, which is a synthetic form of thiamine, in combination with alpha lipoic acid. And there is some research supporting that, particularly if it's diabetic neuropathy, but sometimes other neuropathies also respond.
And they can be hard to treat. I have an email from Carol in Farrington Village. Carol wants to know, what about barefoot shoes? It's a trend. They have wide toe boxes and little or no drop from heel to toe. They encourage the natural shape of the foot and natural walking posture. Will barefoot shoes lessen bunions? What are barefoot shoes again? That seems like a contradiction in terms.
Right. So there has been a trend over the last couple of decades for some barefoot walking. And the original sort of shoe that was that minimalist was called the Vibram 5-finger shoes, which was essentially like a sock with, with the toes spread apart. And so certainly when you look at an athletic shoe, there are different levels of thickness and different levels of minimalist, aspect to the shoe. There are different levels of heel drop, meaning, the heel, the ratio between the heel and the front of the shoe. Some shoes are 0 drop, and some shoes have a higher heel, meaning they're 4 millimeters or 8 millimeters or 10 millimeters. So I think that it depends on the person. Generally speaking, the people that I'm seeing that are having foot pain don't do that well with 0 drop, not 0 drop, don't do that well with minimalist shoes. 0 drop can be fine depending on the person. If you're used to wearing a higher heel drop like 10 millimeters and you drop down to 0, that could be aggravating to maybe your Achilles tendon. So you have to be careful with that. None of these things are going to take away a bunion. So nothing will remove your bunion or take away your bunion without surgery. If your bunion's not symptomatic, you don't need surgery. So that's the clue, right? Like bunions you can live with them certainly if they're not painful, but shoes are not going to remove them.
Okay. Well, we go to Richmond, Virginia. Val Moore, welcome to the People's Pharmacy.
Good morning.
Hi, Val Moore. What's up?
Val Moore. Well, I'm calling regarding a recent bout of, I guess it's plantar fasciitis. I'm a martial artist. I'm 65 years old, been practicing a while. I have a flat foot. My right foot is flat from a previous hip injury, which caused me to walk more on my right foot. So recently I have gotten a bout of where the condition is when I'm walking, I'm okay. I'm fine. But then when I start to relax, when I sit down at my day's end of work or whatever, the heel of my foot starts to ache and get really sore. And I use a phase 4 orthotic in my shoe, so that works for me. But like I said, when I start to relax after a day's end, the heel of my foot is tender and sore. And I want to know what that might be.
Can I ask, does it bother you when you stand up after you've been seated, or is it just when you sit down?
No, when I'm standing and walking, it doesn't bother me. I mean, I've been feeling a little pain, but that was when the onset of the condition. I was doing like toe raises and some other heel exercises to try to minimize it. But when I sit down or start to relax at the end of the day, that's when I feel the most pain.
Sometimes we find that to be challenging because is it really a problem with your heel if you're not bearing weight on it? So I always want to go down the road of, hey, does this patient have a problem with their lower back? And when they sit down, they're changing position and putting pressure on different nerves. So that's something you might want to ask yourself and actually see someone for an x-ray to see if your heel really is problematic or for an exam as well.
What is plantar fasciitis and what can be done about it?
So plantar fasciitis is probably the most common musculoskeletal pain that we see as podiatrists. It is generally starts as heel pain, sometimes arch pain. The most typical scenario is that a person experiences pain when they first stand up in the morning or after they've been seated. And generally speaking, when it first starts, you walk for a few minutes, the pain eases and goes away. But then as it gets worse over time, it becomes painful with every step. And so sometimes it can be very debilitating. But generally, pain in the bottom of the heel.
And what can you do about it?
So there are so many treatments for plantar fasciitis. When I treat a patient with it, I usually start, my spiel is that I start with, these are your negotiables and your non-negotiables, right? So the non-negotiables are the things that I have everyone do. You shall not walk barefoot. You should wear something. Yes. Yeah.
And since Valmore told us he's a martial artist, I'm wondering if he wears shoes while he's practicing his art, whichever art it might be.
Probably not.
Many martial artists are working out barefoot.
Right. And there are actually like compression socks that people use for plantar fasciitis sometimes. But that's a big thing, is walking barefoot aggravates it. So no walking barefoot. You should wear shoes with good arch supports inside or all the time, to support your foot. Stretching exercises multiple times a day, and
Such
icing.
as?
Generally, like the runner stretch where you lean against the wall and your back leg is straight. That's probably your most important one. I tell people stretch when your muscles are warm, stretch for 30 seconds on each side of each leg, and then repeat. So that's 2 minutes of stretching and 3 times a day.
Even if the pain is only in one foot, you still
Correct.
need to stretch both of them.
Correct. And then there are some stretches where you actually bend your toes back, and that isolates your fascia on the bottom of your foot. But stretching is very important. Icing and massage, you frozen bottle of water, you roll your foot over it, and that ices and massages at the same time. So those are my non-negotiables. My negotiables involve things like anti-inflammatories, cortisone injections, physical therapy, splinting like night splints or day splints, booting, like if I have to someone really bad, I might immobilize them. And surgery is a very much a last resort, very uncommon that they need surgery.
Okay. Holly in Florida, welcome to the People's Pharmacy.
Hello.
Hi, Holly.
Please tell us about your question.
Oh, I have my great toe on my right foot has a problem toenail. It was lifting and it was causing me some pain, and it also was causing discomfort when I put a shoe on. It didn't. I'm not sure if it had a fungus in it or not, but I ended up. I've gone to a podiatrist, and he removed the toenail and thought everything was okay afterwards, but it grew back in, and I went back for a follow-up, and he thought everything was fine, but the toenail that grew back in was also problematic. So now he's talking about removing it again. But it's painful to get removed, and I just don't know that when it comes back in, it's going to be the same thing. So I was just wondering if there was anything I could do. The new toenail has adhered to the nail bed, but it never grows all the way to the end of the toe, and it just it's just not right, So I was wondering if there was any.
Let me ask you this, Dr. Henderson. Removing a toenail sounds like torture.
It's really not, but there are good reasons to do it, and sometimes it's an appropriate procedure. For ingrown toenails, which means the sides of the nails are ingrown, we generally just remove a sliver of the nail. But if the entire nail is deformed and lifting, sometimes we have to remove the nail to get a look at the nail bed and make sure that there's nothing under the nail that's causing problems. The hard part about it is that if your nail was deformed because of trauma to the nail root. So the nail root is like, you look at the lunula of your toenail or your fingernail, that's where the cells are that create nail. It's called the matrix. And if that has ever been damaged for any reason, you drop something on it or anything like that, chances are your toenail is going to grow back the same way. If your toenail has a fungal infection, chances are it's going to grow back the same way unless you treat the fungus. So generally, it's hard to magically give you a better nail, but you sometimes have to check the bottom underneath the nail to make sure there's nothing there.
I've got an email from Beth in Virginia. Beth says, while working on a ship, I developed a sensitive swelling. What the crew doc told me was a ganglion cyst on the top of my foot. Stairs were the daily norm for getting from deck to deck, 20 flights a day minimum. Was that the cause? I wrap it when it flares up. I will be returning to the ship soon. Any advice for a ganglion cyst?
That's an interesting thing. I have not, I see ganglion cysts quite a bit. I haven't had anyone with that sort of history in terms of overuse. It's generally not an overuse injury. Generally, it's a condition that just happens. It's an outpouching of fluid that happens either off of a tendon or a joint. Sometimes we aspirate them, meaning we drain them and put some steroid cream in and then provide compression. So if that can be done before you go back on the ship, perhaps it can be in a good condition for a while. Sometimes we do surgically remove them as well.
We are running out of time.
Should we talk to Gary in Texas about his foot and leg cramps, or should we tell him we have run out of time?
Well, Gary, can you make it really fast? What's the question?
Hi. It's a comment. Cramps in the feet. I had them. They started in my young 70s, and my doctor figured out that I was gluten intolerant.
Gluten intolerant. Did that make a difference? When you cut out the gluten, did it help?
Yes, 4 days, and I did not have the nighttime cramps.
Well, thank you for that.
Wonderful.
Dr. Anderson, you ever hear of gluten intolerance and cramps?
I haven't, but that's really interesting. And I'm going to say I love learning things from the people who call. So thank you.
We are just about out of time, as I mentioned. Choosing the right shoe. Can you give us some overview in the 1 minute we have left?
So shopping at the end of the day when your feet are swollen. Going to an appropriate, if you're buying an athletic shoe, go to a shoe store that actually watches as you walk and measures you and things like that, because there are different foot types and they need different amounts of support. So there are neutral shoes, there are shoes with stability, and shoes that are for severe overpronators. Oftentimes people end up with the wrong shoe because they like the color or they like something, oftentimes
looks cute.
Yeah. Or maybe, my older patients want an all black shoe and they get put in a shoe that has too much pronation control for them. And they end up with problems on the outside of their feet because their feet are just being pushed to the outside. So it's important that you're actually examined. Some of our local shoe stores are great because they even have return policies, even if you've worn them. So it's worth spending the full price money to be evaluated correctly.
Well, that is all the time we have today. We want to thank our guest, Dr. Jane Anderson. She is board certified with the American Board of Foot and Ankle Surgery. Dr. Anderson practices at Chapel Hill Foot and Ankle, part of FASMA, Foot and Ankle Specialists of the Mid-Atlantic. Her practice is in Chapel Hill, North Carolina. She specializes in foot and ankle care for children, adults, athletes, and geriatric patients, and is a trustee of the American Podiatric Medical Association.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC, with The People's Pharmacy.
Lynn Siegel produced today's show. Pamela Alberta and Ayasi Chinflu provided technical assistance. Al Wodarski engineered. The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible in part by CocoVia Dietary Supplements. This summer, keep up with your heart and brain health with Cocoflavanols for a strong heart and cognitive support. Consider how CocoVia could be a part of your supplement routine. More information is available at cocovia.com.
Today's show is number 1391. You can find it online at peoplespharmacy.com. You could subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning, and our website is where you can share your thoughts about this show.
If you go to peoplespharmacy.com, you can sign up for our free online newsletter. It's an easy way to stay on top of the breaking health news. By subscribing, you'll also have regular access to our weekly podcast and find out ahead of time what topics we'll be covering. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.